Hello everyone, I'm Dr. Jagmeet Madan. I'm the National Vice President of Indian Dietetics Association, and I'm also the Principal and Professor, Department of Foods and Nutrition, Sir Vittal Das Thakursi College of Home Science, SNDT Women's University, Mumbai. Well, why I'm here? I'm here for a cause. I'm here to talk on behalf of the entire nutrition and dietetics fraternity, and more so as a nutritionist. I'd like to commence by a statement that your food can work as a medicine, provided you use it like a medicine. How do you use medicine? It is a specific component which is quantified, and we use it in a certain frequency, certain dosage, it becomes a medication. Today, the science of nutrition has advanced so much that we can identify the components in food, we can be specific, we can quantify, we can spell out the frequency and draw a checklist and say, hey, this is your checklist for the day of specific foods quantified in terms of amount, in terms of frequency. We take it, it becomes a medication. We all agree that we are what we eat, and when we say this with a lot of conviction and confidence, because we know that whatever are the components within the food, they are creating an internal environment which can be healthy, which can be unhealthy. So it's our choice as to what kind of environment we create within our body. So if we tilt the balance towards an unhealthy environment, let me guarantee you, even a normal value of LDL can become lethal to you. But if your environment is healthy, even an abnormal LDL will not get oxidized and will not do damage to you. This is just to set the stage. Then if nutrition is so important and everyone needs to know what is right for us, we need to appreciate that there is a science behind understanding food. Though eating is common sense, everyone knows what is good and what is bad. But when we connect this common sense with science, somewhere the conviction comes in, and this kind of conviction, when it leads to implementation, gets you results. The moment we say eating is common sense and we have started taking nutrition so lightly, we do find a lot of people making claims to be a nutritionist and making lay statements, reaching out to people. I only want to share on this platform that who is a professionally qualified nutritionist. This information needs to be disseminated, because when I interact with people at large, they have no idea where to go, how to access information, what is reliable information, because they don't even know what are the credentials, what are the prerequisites needed for a qualified nutritionist. Let me share this with you. Today, as a person heading a national body, I can say that at a national level, it is in agreement that the professional qualification for a nutritionist is a graduate degree in foods, nutrition and dietetics with 1 or 2 more additional years of postgraduate education. So that means a minimum of 4 years of training in the field of food, nutrition and dietetics is a prerequisite for you to even calling yourself to be a nutrition professional. The story doesn't end here. We also say that besides this qualification, there should be a defined duration training in a professional environment, whether it is a clinical setting or whatever are the application areas of nutrition. And in addition to that, if specifically a nutrition professional wants to work in a clinical setup, we have made a prerequisite of a registered dietitian training in a registered dietitian trained. Okay, I'm sorry, it's already 5 minutes, so I'll have to cut it. Okay, so thank you. Maybe I can. You can probably edit. I can make a. Yeah, I can just close it by one sentence. Okay. So I just like to say that if a person wants to be a nutritionist, the person should have the prerequisite qualification. 2, if the person wants to practice in a clinical environment, the person should undergo training in recognized registered dietitian training hospitals and pass the National Registered Dietitian Board exam. This is like a benchmark for any trained nutritionist or a dietitian to qualify to be, offering standard dietary practice. I think I just leave you with this thought, and maybe we can continue with some more information in the next segment. Thank you.